So now we talked about movement and structure. We're going to start looking at some of the musculature, and we're going to go in detail now that we didn't go into with the cervical spine, because the principles here in the thoracolumbar region are applicable to the cervical spine as well. And as we said, there's 3 degrees of freedom. You have flexion, extension, and you have rotation left and right, and you have lateral flexion left and right. And when we look at the musculature here, we have 5 major things we're going to look at. We're going to look at the abdominal group, which is really from an anterior and mostly lateral perspective. We're going to look at the erector spinae and the transverse spinalis group. These are both posterior. We introduced these in the cervical spine. We're going to go in more detail here. Then you have some oddball muscles like the quadratus lumborum and a muscle that were familiar to us in the hip aspect, psoas major. Also keep in mind that the psoas major is discussed because it does truly have an attachment to the lumbar spine, lumbar vertebra, but any muscle that's in the hip that connects to the pelvis is also fair game. So that would be like the quasi-6th region would be what we'd consider core musculature. And actually 1 through 5 plus those muscles that attach to the pelvis would make up all the muscles that make up the core. So before we talk about the muscles, I do want to review this whole concept of gravity. When we see gravity, gravity is down, always, doesn't change. Gravity is always down. And so movements that go with gravity are going to be eccentric movements, and movements that are going to go against gravity are going to be concentric movements. Now, there are sometimes movements that are moving faster than gravity that can be concentric in the same direction. So that's you trying to throw something to the ground. But for the most part, you have, when gravity's coming down, and you're going with gravity, and you're usually controlling movement. So decelerating, that's going to be eccentric. And when you're trying to overcome gravity, either against the direction or with the direction moving faster, it's going to be an accelerant that's going to be a concentric activity. So when we look at spinal flexion, trunk flexion, in this case we have gravity that's coming down. Both of these images are the same. It's just one's rotated 90 degrees, but just changing orientation and gravity. But both of these are spinal flexion. Now what's different is one's with gravity and one's against gravity. So when we look at this joint action here, we're going to see that the joint action is exactly the same. Right? It never changes. What you see is what you get when it looks at joint motion. But the one on the right is a concentric activity because it's overcoming gravity, and the one on the left is an eccentric activity because it's going with gravity. So the one on the left is going to be an eccentric contraction of the thoracolumbar extensors, even though it's joint flexion that you're seeing. So you're seeing thoracolumbar trunk flexion, but this is being controlled because it's moving slower than gravity or a controlled environment or counteracted by the extensors. And the one on the right, this is going to be a concentric activity produced by the flexors. So that's the big difference. The joint action is the same. The muscle participation is different because the orientation to gravity or the load is different. We'll look at it here from a standing perspective. We look at gravity down and we produce, let's say, trunk extension here. So we're looking at extension through the thoracolumbar spine. This is moving with gravity. So this is an eccentric activity, which would be an involvement of the flexors eccentrically, right? Even though you saw joint extension, this is eccentric control from the abdominal flexors. In the abdominal muscles, their primary concentric activity is trunk flexion, just the opposite. So if we wanted to make this an extensor exercise and not a flexor exercise for the concentric, I'd have to reorientate myself to gravity. So I'd have to go prone, produce the same motion again, thoracolumbar extension. Now I'm moving with gravity. That's a concentric activity, and now it is the concentric activity of the extensors. So in the previous one, we looked at the still extension, but since the orientation of gravity was going with gravity, it was the flexors in here. So you got to make sure you're keeping track of, are you going with gravity or against gravity? Same thing with lateral flexion. This doesn't happen. I just like this image. It looks like a spine being unzipped. But when we see here, we'll see gravity is down, and you produce lateral flexion. So you're bending. In this case, the skeleton's bending to its right. That movement's occurring with gravity, right? You went from a higher position to a lower position. That's an eccentric contraction of the contralateral side on the opposite side. So it's going to be the lateral flexors, not on the right side, but on the left side, the opposite side, because of the orientation of gravity. We'll start looking at the abdominal cavity first, and we'll look at the abdominals, usually referred to as the anterior muscles, but they really are lateral. And you have the erectus abdominis, which is the primary anterior muscle, and you can see that the rectus runs from the xiphoid process in the sternum down in the first couple ribs here, or the middle false ribs here, down to the pubic symphysis. And you can see that it has these tendinous inscriptions that go laterally. And these each have different neurological control. And when the muscle contracts, it definitely does trunk flexion, and they contract bilaterally. What the rectus abdominis really does is that there's a connective tissue here called the linea alba, and you can see the external oblique out here, and then you'll see the internal oblique later. But the rectus abdominis really is a functional tendon. It's a foundation that the other trunk muscles anchor off of. And so what happens is during all these weird positions we get to in standing, twisting or bending, or think of different sports positions, it allows as a stable base for the oblique muscles to be able to contract off of. So the rectus abdominis really is a stabilizing or functional tendon, if you will. You can see this image here. This is the image that you have in your handout. You can see the highlight of the origin and insertion. And then we move to the transverse abdominis. So we had the rectus abdominis, which was up and down, and now we have the transverse abdominis, which is the deepest of the abdominal musculature. And this is like a corset that wraps around the back. And so you kind of see the thoracolumbar fascia here, and you can see the belly of the muscle. And when this contracts, it's basically like a hoop that sucks your belly button in. We talked about this in the respiration, or if you haven't watched that video yet, we'll talk about in respiration in terms of a stabilization mechanism. And this transverse abdominis with the diaphragm, the pelvic floor, and the multifidus, the deep muscles of the back, it creates a capsule here that creates a hydraulic amplifier to help offload the spine. But the transverse abdominis has this transverse or horizontal orientation for its connection. We start looking at the internal oblique, and you can see that the internal oblique is, again, an anterior but mostly lateral muscle. It also has its connection in the thoracolumbar fascia. It does trunk flexion, it does trunk rotation, it does lateral flexion. It has its movement in all three planes. And then its complement is the external oblique. And you can see that it also does rotation, does lateral flexion, and it also has a lateral component. And so when we look at the function of these muscles, we're going to look at them collectively as a group. Again, you can kind of see these diagonal patterns. That's why it's called the oblique. This is the external oblique, and the internal oblique had a similar component. And you can see that this oblique line that's not quite sagittal, not quite frontal, not quite transverse, goes through all three planes. And depending upon how these muscles are contracting, because you have left and right of both of these, this is just showing the right external, left internal, you can get different various trunk positions. So that's to come in the next couple slides. We look at the erector spinae group. You had the ilicostalis, longissimus, and spinalis. Again, you have a capital region, cervical region, thoracic, and lumbar spanning the entire aspect. We looked at the capital cervical region in the previous cervical spine. We're going to be looking at the thoracolumbar component now. We have the ilicostalis, which is the most lateral, and you can see that it does trunk extension. It's going to do ipsilateral rotation, so the right side ilicostalis is going to turn the head to the right, and we'll look at how that happens in the next slide. And it's going to turn the body to the right. Same thing with the longissimus. It has a similar attachment. It's, instead of having this lateral attachment, it's a little bit more medial. And then you have spinalis, which is pure extensor because it goes from spinous process to spinous process. So its line of pull is purely in the sagittal plane. Then we have the transverse spinalis group, which again has this orientation like a Christmas tree, where you have the semispinalis, which is spanning about 4 or 5 fibers. The multifidus about 2 or 3 fibers, and the rotatories 1 or 2 fibers. But basically their orientation is from lateral to medial, and the contraction here is going to do, when you look here at the multifidus, when you look here at this relationship, this down, and again it's just looking at multifidus, but this is reflecting of all the transverse spinalis because they have very similar component, just this 5 span versus 2 versus 3. It does extension. It will do lateral flexion to the same side. And then when this contracts, it's going to pull. It's going to do left trunk rotation. So the right shoulder is going to go forward into the screen. This is opposite than what you were seeing with the erector spinae group. And then you have the semispinalis, which is also part of this the transverse spinalis group. And we also had this prior to in the cervical region. You have some other random muscles here, that interspinally and intertransverse muscles that are just little tiny muscles that are in between each of the segments. And all of this is packed into the lamina of the vertebra. So there's your transverse process, there's your spinous process. You can see the longissimus that's just on the rib, just right next to the transverse process, and then right next to that's ilicostalis. It's all covered by latissimus dorsi, and then you have trap on top of that. So you got a lot of stuff going on tucked into this tight little space. Next you have quadratus lumborum, and so you have this muscle that spans between the crest of the ilium and the 12th rib. This muscle it's considered a back muscle, but it's so deep and it's almost midline that it can sometimes be referred to as an abdominal muscle depending upon where your starting position's at. But in anatomical position, it is an extensor, but it's primarily a lateral flexor. So it does lateral trunk flexion, so will do the same side flexion, and it's a hip hike. So if you do like a standing hip hike, you try to bring this right hip up, it's quadratus lumborum that's going to be the primary muscle doing that. I have an image here where you're looking at it from a lateral view, and you can see like if this is the plumb line here, it is an extensor, but if you are already in flexion, it might lock you into that position. So it's a deep muscle of the back, can be right in that midline there. Here you're seeing the quadratus lumborum superimposed behind the psoas and then iliacus, and you can see it makes this like supporting musculature through that. Which brings us to our final independent muscle, which is the psoas major, and iliacus a little bit because of the effect on the pelvis, but psoas, as you can see, actually has attachment to the 5 lumbar vertebrae, both at the anterior body, you can kind of see right here, and at the transverse process. And so when this muscle contracts, it's not only just bringing the hip, it's not affecting the pelvis, it actually has no attachment to the pelvis. It crosses the pelvis. The iliacus is the one that crosses that is in the pelvis aspect. And remember, they converge to become the same tendon. But you can see that it can pull here, and it can either do flexion if you allow the upper body to move, or it can emphasize lumbar extension if the upper body is locked in position. And we'll talk about this in terms of its sit-ups, but this hip flexor weakness, psoas weakness, is some of the reason why full sit-ups were thought to be a bad exercise, because it's creating this lumbar arch. And again, that's only if there was some weakness here. So it's important to understand the muscle line of pull. And so when we look at like the erector spinae versus the transverse spinalis group, we see here that like one thing about the transverse spinalis group is that there was different ranges of spanning of these musculature. The more of the spanning that occurs, the less horizontal you become and the more vertical it becomes. So when you look at like semispinalis, it's going to have a more powerful effect in extension than it will in rotation, but it does have a horizontal component. It will be involved in rotation, whereas like your intratransversi and interspinalis, they have no horizontal component, so it's going to be purely sagittal plane motion. And then when you look at like the rotatory brevis, which have a very cross one junction, mostly horizontal, just a little bit vertical. But you can see that through all of them, they have some level of vertical and horizontal component. So these lines of pull on how they're pulling on either the ribs or the bony structure gives moment arms and changes the mechanics of the musculature. So like when you look at rectus abdominis from a flexion extension aspect, it has a huge moment arm for flexion versus the longissimus thoracic, which for extension, right? But then when you look at like rotation component, you can kind of see that you have to take in consideration where the muscle's pulling on and the effect that it has into the axis of rotation, which is the lumbar body. When we look at the oblique muscles, they are mostly lateral. They have this oblique orientation. And so when they shorten, not only do they shorten horizontally, but they also have a vertical pull as well. You have a vertical component and a horizontal component that these oblique muscles are pulling in. Same thing with the erector spinae and the transverse spinalis group. So you have your erector spinae here on the left, so this is iliocostalis, but longissimus also has similar orientation. You have your transverse spinalis here, all of them have this component, and you can kind of see the midline here and where they're contracting, and when they do their job and they contract, they're going to change their orientation. So they're going to have a vertical and a horizontal component. And that's why when we looked at the erector spinae and transverse spinalis, yes, they're powerful extensors, but they're also involved in trunk rotation as well because of that horizontal pull. And that's what you're seeing here is as they shorten and they go into extension, they're also pulling into rotation. So the transverse spinalis group, they originate at the transverse process and they go to the spinous process. And when they shorten, the more superior end is going to be more mobile than the inferior end. When this shortens, it's going to pull in that direction. So as this shortens, you saw this is lengthening and this is shortening the transverse spinalis group. This is a left transverse spinalis muscle and it's moving the front of the anterior body to the right. So this is doing contralateral trunk rotation, right? So when we look at that again, this is your resting position, and it doesn't matter if any of these, they have a vertical component here or a horizontal component besides just a vertical component. It's going to pull that anterior body to the right. So you're going to get contralateral rotation with the transverse spinalis group. When you look at the iliocostalis or longissimus, now I couldn't find an image, so I just flipped the other one over on its side, but the orientation of the attachment is the same. You have a medial proximal attachment and a medial inferior attachment and a lateral superior attachment. So it's kind of making that V going up in this direction. So you're kind of pulling on the transverse process or using the rib as a lever, but I just, for graphic sense, I just put it here. And you can see that when it pulls now, so same thing, a left side muscle, when it contracts, it's going to shorten. It's going to do ipsilateral rotation. Right? So again, when I have this left-sided muscle, so iliocostalis or longissimus, and it shortens, it's going into extension for its vertical component, and it's doing rotation for its horizontal component that created ipsilateral rotation. So transverse spinalis group does contralateral, and erector spinae does ipsilateral, depending upon do you have a medial to lateral attachment or lateral to medial attachment. And so when you look at left rotation of the trunk, that's going to be the ipsilateral erector spinae group and the contralateral, so the same side erector spinae and opposite side transverse spinalis group doing rotation. So these are agonists in that position. The left side transverse spinalis group is going to be an antagonist in trunk rotation. And what's happening is this alignment, right? So this is the erector spinae doing the medial to lateral attachment, and the transverse spinalis doing lateral to medial attachment. And they're going to work together in rotation. They're going to work together in extension, but where they'll be antagonists to each other is now lateral flexion. So if I side bend to the left and I have a concentric muscle contraction, that's going to be same side erector spinae and opposite side transverse spinalis is going to be relaxing. We'll look at the abdominals, and same thing, they have a similar type component. First here you can see the different layers, and you see that external oblique is the most external, so that's why it's external, internal, and the deepest abdominal muscle is the transverse. Rectus abdominis tends to run through them. They're sandwiched between. As they get lower, the transverse abdominis becomes more on the superficial side, but you can see that the internal oblique and transverse sandwich between the external oblique. And you can see that the tendon comes down, and this is the central tendon that most of these strong, big abdominal muscles anchor into, and it's basically the tendon that the rectus abdominis controls. So as I was saying that it's an active tendon, that's what I was referring to. I just had this other slide as a complement to look at the back musculature, and you can see the moment arms for the psoas major, quadratus lumborum. See how tight it is. It's almost anterior, but right there, right with the psoas. If this is a flexor, this is an extensor. They're right at the almost same plane. And then you can see your erector spinae and your transverse spinalis group tucked in really deep there. So when we look at these different rectus abdominis, obliques, and the transverse, there's different lines of pull that exist there. So when we look at the rectus abdominis, rectus is straight up and down, and it is primarily operating in the sagittal plane. In the transverse plane, it's looking at, or in the transverse abdominis, it's primarily working in the transverse plane. So you don't really have much movement outside of bringing the torso forward or bringing the abdominal contents in. When you look at the obliques, both internal and external, they are called obliques because they're at a diagonal. So you have this 45 to 60 degree change in angle, so there's a horizontal component and a vertical component. These aren't just like lateral flexors and rotators. If I take the resultant of this and I look at these two force angles and I bring them forward, if both sides are contracting, they result in this trunk flexion. So they are just as much working in the sagittal plane as rectus abdominis. So people think that obliques are just for rotation and lateral flexion. Your primary, because of the angle of pull and how big these muscles are, your obliques are the strongest abdominal muscles, external and internal. The rectus abdominis is supporting musculature. Just because these are at an angle doesn't mean they don't have a vertical component. Them together, they have a vertical component. But how these really work at is when you're looking at opposite sides, so contralateral components. And you can see here that you have a line of pull here for the external oblique, and then you have a line of pull for the ipsilateral internal oblique, that it has a resulting force that is at a diagonal cross. And so I had said earlier, when we start looking at the torso, we want to keep track of what muscles are happening. So if we're looking at this region here, we said rectus abdominis has a straight up and down pure sagittal plane and a vertical alignment. And your transverse abdominis has your horizontal aspect covered. Your internal oblique has a medial to lateral aspect, and your external oblique has a lateral to medial aspect as well. So you kind of have this, if you want to represent these muscles with these force angles, this will help you kind of be a guide to see how things are moving. And so if I'm in a situation where I have full activation of the entire abdominal aspect, so both external obliques, both internal obliques, and the rectus abdominis and the transverse, that's going to bring my torso forward, and it's going to be trunk flexion, right? That's the concentric activity that's going to be created. If I have my external oblique, everything on my right side here, so external oblique, then internal oblique, and the right side rectus, that's going to pull me into lateral flexion. So left lateral flexion to this side. And of course, if I had all these guys contract, these guys would be here. And this is concentric activity. So we're just assuming that we're in a supine position here. If I have a situation where I have my external oblique on one side, internal and transverse oblique on the other side, that's going to produce same side rotation to the internal oblique. Right external oblique, left internal oblique is going to create left trunk rotation. So the torso is going to be rotating on top of the pelvis. And if the opposite is true, the right external oblique, left internal oblique is going to create left trunk rotation. So the torso is going to be rotating on the pelvis. And it's depicted here where you see the muscle shortening and it's pulling those fibers there. So this is your external oblique, this is your internal oblique, and if your feet are on the ground, your torso is the more mobile end and your pelvis is the more stable end. So this is going to move, and if these straighten out, they're going to take out their horizontal component during their vertical component. It's going to result in right trunk rotation. So the way that I remember it is I just remember that the internal oblique is always the same side of the rotations occurring in when the torso is moving relative to the pelvis. So if the feet are on the ground and I'm turning to my right, it's going to be right internal oblique. If my feet are on the ground, I'm turning to my left, it's going to be my left internal oblique, left transverse abdominis, and the external oblique is going to be the contralateral. It's going to be the opposite side. So ipsilateral for trunk rotation, for right trunk rotation, it's going to be ipsilateral internal oblique, contralateral external oblique. Here you can see the axes of rotation, and you can see your flexors and lateral flexors here on this side, and you can see that the rectus abdominis and obliques are your flexors, your quadratus lumborum, your psoas major. Again, it splits the difference. Your psoas can be both a flexor and an extensor. Same thing with the quadratus lumborum, depending upon starting position. Your rector spinae are always extensors, and then you have lateral flexors. And so part of your analysis is to figure out who's working as agonist, antagonist, not just sagittal plane or frontal plane, but also in the transverse plane as well.